The rotator cuff repair surgery is indicated in individuals who have either had a full thickness rotator cuff tear or a partial thickness rotator cuff tear that have failed conservative therapy. So if you think you have a partial thickness tear and you haven't tried conservative therapy yet, this is a good chance for you to kind of cycle over to our rotator cuff regimen and start there. If you've had surgery, this is a great place to kind of learn some educational materials about your surgery and some good ways to kind of get started on your rehabilitation journey. So the rotator cuff is a group of 4 muscles that kind of surround the shoulder joint to work to stabilize that shoulder joint and to help with movement of the shoulder joint. So a repair of these muscles comes with a lot of considerations as we're kind of getting back to full function. Usually after a rotator cuff surgery, you're going to be in that kind of sling for about 4 to 6 weeks with some pretty heavy restrictions. It's best to kind of consult with your surgeon first before starting any kind of rehabilitation journey to make sure that you are abiding by your specific precautions, as a lot of rotator cuff repairs come with some specific kind of nuances to their recovery. So just confirm with your surgeon first before starting any kind of rehabilitation. Oftentimes, after this rotator cuff surgery, these first 4 to 6 weeks where we're not able to kind of actively move that arm are a huge, critical kind of point to improve our passive mobility and our posture. So these kind of early stages of rotator cuff repair are going to be massive to make sure we're reducing kind of pain and inflammation and making sure that we have good passive mobility of that shoulder to set us up nice for that intermediate stage. In the intermediate stage of rotator cuff repair, we're going to work on kind of correcting posture, improving activation of the rotator cuff muscle, and making sure now that we have full active range of motion. So in those first 4 to 6 weeks, we're working really hard on passive range of motion, or not using our muscles, but moving the shoulder without the use of our muscles. In that intermediate stage, weeks like 6 to 10 to 12, we're working on active range of motion or using our muscles to work the full range of motion of the shoulder joint. Beyond that, so kind of in that end stage rehab, we're going to be working on functional strengthening, getting you back to lifting things overhead, getting back to some quicker motions that might be uncomfortable in that intermediate stage and inappropriate to do in that intermediate stage. That next and final stage is going to be any kind of return to sport considerations. That includes if you're wanting to kind of shoot basketball or throw baseball with one of your kids, something like that. We want to make sure that those are kind of the last things to come. Those kind of motions take a lot of pressure on the rotator cuff. So we'll kind of start with the basics. We'll kind of progress you all the way through and kind of take you along your rotator cuff rehabilitation journey. The first exercise I give after a rotator cuff repair is often the most basic, and it's just going to be a ball squeeze. So oftentimes your sling is even going to come with a ball on the end of it to kind of squeeze. That's an important exercise for you. So this is kind of there's a couple reasons why this is so critical after a rotator cuff repair. Number one is we're improving blood flow through muscle contraction. But number two is we're keeping the dexterity of our hand intact for these kind of 4 to 6 weeks while we're in the sling, and we're keeping the strength of our hand and wrist intact. So you're going to hold on to that ball that they give you at the end of those shoulder slings, and you're going to squeeze it forcefully. So you're squeezing forcefully, holding for a second or two, and then relax. Again, this is going to help you kind of reduce that kind of pain and inflammation, the swelling that you might get in the fingers. This is also going to make sure that you're maintaining the dexterity and strength in that hand. So I typically tell my patients you should be squeezing that ball about 100 times a day. If it works best for you, 5 sets of 20 is usually a pretty good kind of number to shoot for. You should be kind of aiming to squeeze that ball about 100 times a day. It should feel good. So the first exercise here is just that stress ball squeeze. The next exercise for a rotator cuff repair is the scapular squeeze. So what you're going to do is you're going to squeeze your shoulder blades back, hold for about a 5 to 10 count, and then relax. So this is one of the only exercises you can do in those first 4 to 6 weeks to help with that posture. So we're really going to utilize it. You're squeezing those shoulder blades together, hold for a 5 to 10 count, and then relax. Those pectoral muscles, those muscles on the front side of the chest can get so tight while you're in a sling for that long. All those muscles are kind of shortening and healing in a shortened position. So it's so important to do this exercise. 1, to kind of make sure that we're still getting good scapular control. 2, to kind of stretch those muscles on the front side out. So I want you to do a lot of sets and reps of this. So in your day, we're going to do at least 5 sets of 10, holding for that 5 to 10 count each time through of this scapular squeeze. So picture that you're kind of squeezing something between your shoulder blades here. So those shoulder blades on the back side, I'm picturing like I'm squeezing something right between those blades, holding for that 5 to 10 count, and relax. It should feel good. It should feel nice to do this. You can do this while you're in your sling. This is called the scapular squeeze. This next exercise is called a pendulum. This is a great exercise to decompress that shoulder joint in those first 4 to 6 weeks after a rotator cuff repair. And this is one that a lot of folks just kind of keep around for a long time because it feels good after a rotator cuff surgery. So what you're going to do is you're going to get up next to either a table or a sturdy chair, something that you can kind of lean your upper body on with the non-surgical arm. So in this case, I'm going to show this as if my left arm is my surgical arm, and my right arm is the non-surgical arm. So you're out of your sling for this, and what you're going to do is you're just going to kind of post up here so my right hand is supporting my weight. I'm just letting that left arm go. If you're new to this, it's kind of good to just kind of work on just relaxing your bicep for the first week or two. So a lot of times that bicep is going to be so guarded up, so it's good to just relax that bicep and just kind of let that arm traction out. Once you've let that arm kind of traction out, you're going to slowly just shake the hips kind of side to side. My arm is just along for the ride here. I'm thinking just progressive relaxation of my arm. I'm just moving those hips side to side for about 15 reps. And then I'm moving the hips up and down for about 15 reps. Then we're going to do clockwise rotations at our hips, 15, and then counterclockwise. Again, if you watch my arm here, I'm not shaking my arm back and forth. I'm not really doing anything at my shoulder other than just trying to let it relax. The goal here is just a little bit of gentle distraction at that glenohumeral joint or that true shoulder joint. We're trying to get the ball just kind of distracted away from the socket. So we're going to go for about 15 reps front and back, 15 reps side to side, 15 circles clockwise, 15 circles counterclockwise. In your day, you're going to do about 3 to 5 sets through of 15 of each of those. Again, this is one that should just feel nice to do. It's good to get out of that sling. You're in a really safe position there. Just make sure your hips are doing the work. This is called the pendulum swing. In those first 4 to 6 weeks after a rotator cuff repair, a lot of protocols are going to allow for the use of the shoulder pulley. This is a great tool to start working on some passive range of motion in the early stages after surgery. This is a good place to check with your surgeon about any specific range of motion precautions that you have, as a lot of massive versus moderate versus minor rotator cuff tears are going to have slightly different precautions. So check with your surgeon about your specific precautions before starting the pulley exercise. The pulley is going to be a good thing to kind of keep around for the long term during your recovery, because as your restrictions get less and less, you can start doing more and more with the pulley. But what you're going to do is you're going to set up with the pulley, and for these first kind of 4 to 6 weeks, you're going to do this standing, because if you sit down for this, it's going to be too easy to go too far. So you're going to use your non-affected arm to slowly pull down, and your affected arm is going to go up. The important thing to note here is your affected arm is just along for the ride here. So there's no active use of that affected arm here. It's just passive. So I'm pulling down with my right arm and my left arm is slowly rising up. I'm listening to my body here. I'm not pushing past any pain barriers. I'm just trying to get a little bit of motion up. I'm kind of stopping there and slowly back down. So I'm stopping here around 90 degrees of shoulder flexion, which is usually pretty appropriate for those first about 4 weeks after surgery. If your surgeon's a little bit more aggressive, you can kind of talk with them specifically about starting to do the seated shoulder pulley protocol, which might get you a little bit further into that flexion position. So for this, we're kind of being a little bit more conservative, getting it about that 90 degrees here, about 10 to 12 reps, 3 to 4 times through a day, and then back down. We can also slightly angle out to the side. If I kind of pull across my body here with my left arm or with my right arm, my left arm is going to reach up and out just a little bit to get into some abduction. Again, I'm not going beyond shoulder width for right now unless you're specifically cleared by your surgeon to do so. I'm getting to about that 80-90 degree position, and that's all. Again, I'm listening to my body too. So if that doesn't feel comfortable, we're not trying to push through any pain barriers in this first 4 to 6 weeks. Going for about 4 rounds through, 3 to 4 rounds through in a day, about 15 to 20 repetitions, making sure that we're really slow and controlled with this. This is the shoulder pulley exercise.